Hello everyone, thank you for joining us today. I'm Jenny from education team at Medit and nice to meet everyone. And as you can see, we have a special guest from Italy. Please welcome Dr. Andrea.
Thank you, Jenny, for the kind introduction. And today I want to thank Medit for this webinar. And today we will talk about the perfect prep design for veneers with Medit. That is my friend because the new i900 is with me when I want to do veneers and when I want to do aesthetic cases. So today I will show the workflow, the digital workflow from the first visit to the delivery for the veneers, only in the digital way. So
Everybody is concerned about aesthetic nowadays a lot, so it's going to be a really interesting topic for everyone.
thank you, Jenny. And we can start with the digital patient that is the patient that is digitally done with Medit and other hardware and software. Then we can go in the Medit link and the Medit scan to do all the tools and all the workflow, the digital workflow to be done to achieve a good result.
Actually, I know that you are an author of Digital Patient, right?
Yeah.
So it's
Yeah,
really interesting.
yes, because it is a concept that I create the avatar in the first visit. So I have in my clinic here in Monza, that is in Italy. I have a space with the facial scan, with the Medit scanner, the intraoral scanner, the CBCT, and also the 3D printer. To do this digital patient that is not the virtual patient, because I follow the patient in every step of the life of the patient. When the patient is child, then adult, and then till the end of the life of the patient. And so we can do the digital patient, so the face and hold the avatar of the patient with AI to study and to do treatment of the patient.
Okay, aesthetic success is treatment success, right? So it's going to be really interesting topic for everyone. So before I jump into our webinar, I want to briefly introduce about Dr. Andrea and move on to our lecture.
Thank you, Jenny. Okay.
Okay, this is a profile page of Dr. Andrea, and let me briefly introduce about him. Okay, Dr. Andrea is a freelance dentist and an expert in digital dentistry, having graduated from the State of University of Milan in 2020. As the creator and CEO of the innovative concept Digital Patient, he is dedicated to advancing the field of dentistry through technology. An active member of Digital Dentistry Society and career for Medit, he is recognized for promoting technological solutions, including the concept Tartar Q and Pardon OK. And as I have mentioned, this is interesting part. Also, in 2020, he authored the book Digital Patient in Dentistry. And as a highly regarded speaker, he shares expertise at both national and international meetings, inspiring colleagues and influencing the future of dental care. Okay. Is there anything you would like to correct or add about your profile?
No, it's perfect.
Oh, okay. So let's move on to lectures that you prepared for today.
Okay.
Okay.
Hi everyone and welcome to this webinar titled The Perfect Prep Design for Veneers for Medit. And I'm Dr. Andrea Bevilacqua, and today I'm going to take you on a journey through my digital workflow for designing minimally invasive veneer preparations using Medit and other integrated technologies. What I truly believe and what I show you today is that by combining multiple digital tools, we can deeply study a prosthetic and aesthetic case even before the patient sits in our dental chair. And before we even touch the teeth, we already have a complete data-driven understanding of the situation. This approach doesn't just improve accuracy, but it transforms the entire patient experience. So let's dive into how we can use Medit to plan with precision, design, and confidence, and execute with excellence. So let me introduce the case, the patient we were working on in this case. She is a woman in the early 60s, and we came into our clinic for a consultation with very clear requests. Doctor, I want a natural but beautiful smile. So this is the request. And at first glance, her oral situation is quite unique. In the upper and the left quadrant, sector 2, we can see a displaying of the anterior teeth, a consequence of an aggressive form of juvenile periodontitis. Luckily, the periodontal disease has now been fully resolved, but its aesthetics and functional impact remains. The smile appears asymmetrical, not straight, and there's an evidence discrepancy in both the color and the position of her teeth. From a purely diagnostic point of view, orthodontic treatment would be the ideal first step. But the patient was very clear. She doesn't want a long or complex treatment. She wants to achieve the smile she always dreamed of, and without waiting months or years. So the question we asked ourselves was, how can we create a beautiful, natural, and stable result using a minimal invasive approach with a limited timeline? This is where the power of digital dentistry and Medit comes into play. And wow, boom. This is the smile we achieved for her, a result that is both natural and beautiful, exactly that she asked for. Today I'm going to walk you step by step through how my team and I approached this case. You see the logic behind every choice we made with the tools we used, and how we combined clinical experience with digital planning to reach the performance balance. And it's what I like to call an happy compromise, because a solution that respects the biology, meets the patient aesthetic desires, and fits within her timeline expectation. So, which digital workflow? The big question is, which digital workflow allow us to get there? So what steps, what tools, what logic did we follow to transform that first complex situation into the final smile? And before we dive into the practical workflow, I always like to take a step back and ask, why do we choose a certain treatment plan? So where does the therapeutic decision come from? And above all, how do we know what kind of dentistry the patient truly needs? The answer begins with biology, the deepest and most fundamental area of our discipline. We can consider the periodontal tissues, cellular responses to trauma, healing mechanism, and all the microscopic realities that define long-term success. These are things that we have studied over the years and integrated in our clinical reasoning. But today, to make the right decision, we need more than just experience. We need data. So the next question is, what kind of data do we need in order to truly understand this patient before we even start? And you can see the patient's intraoral condition. So we have the X-ray on the right part of the screen, but we've got an implant on the tooth 1.3, an extruded between 2.2 and 2.3 that was rebuilt with the composite. Even just from the single photo, we already have quite a bit of information. We can see the challenges, the asymmetries, the materials involved, but in this enough to make a decision? So the truth is, no, it's not. Because dentistry isn't just about the teeth, it's about the person. So, and truly understand what kind of aesthetic and functional outcome we want to create. We need context, and the context is the face. So here we have the face of our patient. We can see a few key elements that immediately gives off more context. A gingival display that is not excessive, an elongated facial shape, thin lips, and all of which suggest a lean, elegant woman with refined taste, someone who appreciates subtle beauty over exaggerated change. This is why facial analysis is so important. It's allows us to match the smile not only to the teeth but to the person, their proportion, their personality, their identity. And this changes everything in our treatment planning. To truly comprehend the spatial positioning of the teeth, we must analyze the mouth and the face from various angles. So this comprehensive approach allows us to assess the alignment, symmetry, harmony of the dental structures with the facial context. By capturing images from different perspectives, we can identify subtle discrepancies and plan treatments that align with the patient's unique anatomy and aesthetic desires. This multidimensional analysis is crucial for achieving optimal results in restorative and cosmetic dentistry. Now that we collect essential 2D data, facial photo, intraoral images, and different angles, it's time to add the third dimension. And this is what the power of digital dentistry really begins. By using the Medit i900, we capture a detailed 3D scan of the patient's mouth, including teeth, soft tissues, gingival contours. This scanner is fast, precise, and extremely reliable. With just a few minutes of scanning, we can visualize the real anatomy of the patient in a way that static 2D images simply can't provide. It's foundation of our digital planning that it's where the true customization begins. And so the patient agrees with the plan. It is to grab the burr and start prepping the thing. Yeah, is right? No, it's not right. Absolutely not. We don't start by prepping the TED. We don't start sending the work to the lab, but we start by building a bridge between our plan and our hands. This bridge is the 3D mockup. It could be real, it's virtual, but it's the mockup. It's to study the new aesthetics and function of the teeth of the patient. And we add some pictures to evaluate also small details and colors that we can evaluate in the mouth of the patient. So we have the start, the mockup, and the prep. This is the classic flow. But sure, the 3D mockup is a great tool, and yes, for years we used it to print a model, make a silicon index, and guide our preparations. But that's an old school of digital dentistry. We can and must go beyond. Today we entering in a new era, and the era where we don't just see and design teeth, we design patients. Welcome to the concept of the digital patient, a dynamic, layered, full data version of the individual sitting in front of us. It's not just about the aesthetics anymore, it's about creating a digital twin, one that lets us simulate, plan, execute with a level of accuracy that was unthinkable just a few years ago. And here we can see it clearly, the patient with the preps, the mock-up design over the prep, and the 3D facial scan, all merged into a single and unified model. This is the true power of the digital patient. It's not just about the visual checks of estimating reduction. It's about working with a complete digital ecosystem where all the patient's data, intraoral, facial, photographic, radiographic, are perfectly aligned. This gives us an unmatched ability to evaluate thickness, proportions, incisal edge positions, all in context. And that context is everything if we want predictable, aesthetic, and biologically respectful dentistry. This is where Medit design comes into play as a Medit app. And here you can see how we use the software to slide through both the mockup and the actual prep scan, the initial situation. This allows us to visually and numerically verify at the micron level where we have enough space for the final veneer or crown. It's an incredibly powerful step because it gives us objective confirmation before we ever send the final scan to the lab. And we under-prepped, we over-prepped, do we have the perfect space for our restorative material? With Medit design, we don't guess, we measure. This is the key question. Is there enough space? Enough for the material, enough to guarantee resistance, enough to avoid over contouring? And here with Medit design, we don't have to guess. The software gives us a precise color map. In this case, blue indicates the available space between the mockup and the actual preparation. In just a few seconds, we know where we are perfect and we might need to adjust. This step transforms our dentistry from subjective to data-driven. It's control, it's predictability, it's digital done right. Is there enough space? Another picture of the space for the restorative. Here is the bridging between the preparation, that it is not bridging because we have a powerful scanner in our hands, and also the preps are good enough to catch the space between the gum and the teeth. But the other question is, where is the finishing line? So in veneer cases, margin clarity is everything, and Medit design helps us to see it clearly. By applying a simple filter inside the software, after placing retraction cords, we can highlight the end of our preparations with high contrast. In this case, the margin show up in blue, precisely making where the veneer will end. This 3D file with the visible finishing line can be attached directly to the case we send to the lab. So it becomes a powerful guide for the technician, ensuring they design the CAD with the maximum accuracy and zero guesswork. This is not just a scan, this is communication between dentist, patient, and lab. And communication is what makes a good restoration and a perfect one. Here's a question I love asking, and which scan should we send to the lab? Because let's be honest, 99% of dentists will send only the perfect scan, the last scan, the final preparation scan, just like we used to do in the analog work with a single impression. But digitally gives us so much more. We already have all the data: the original scan, the mockup, the prep scan, the facial scan, the margin visualizations, even the bite registration in starting and move. So why not just add the final scan to the digital ecosystem? Align it properly and send the whole story of the patient. It doesn't take more time, but it gives the technician more clarity, more context, and more control. That's smart dentistry. This is where it all comes together. Thanks to the complete digital patient we've built, the dental technician can now design and craft the prosthetic work with full visibility, not just of the teeth, but the patient as a whole. And they're not working in the dark anymore. So they see the facial context, the mockup, the margin definition, the real tissue contours, everything. And what the technician has access to that level of information, they can create something more than just a crown or veneer. They can create a personalized masterpiece. These veneers are a result of well-planned and carefully executed team effort. Thanks to the digital patient, the technician have all the data needed to create a restoration that fits both in the facial and the patient's expectation. Every detail was planned in advance, from the prep thickness to the final margin line. Digital helps us be more precise. The technician's hand and eye still make the difference, and when the data is clear, the result speaks for itself. Here we can see the veneers in a clear, natural setting. Each veneer is slightly different, just like the real teeth, to match the individuality of the patient. The thickness is minimal, the edges are delicate, and the color is layered to reflect light naturally. This is the kind of result you get when planning is precise and execution respects both the material and the anatomy. Here we can see how each preparation is slightly different, carefully adapted to the specific tooth and its condition. Right after removing the mockup, we train the veneers and crowns, but but we still need a few more days for the soft tissue to fully adapt to the final restoration. By overlapping the prep and the veneer position, we can quickly check the proportions and the final harmony at a glance. And here's the same check-in in 3D. Overlapping the prep scan and the veneer model gives us the full control over space, fit, precise before final cementation. The dense triangle meshes generated by Medit eScan allows for precise overlay of preparation and veneer scans, ensuring accurate assessment of fits and margins. By 3D model perfectly aligned, we can apply different filters, for example, without changing scan coordinates, giving us multiple ways to visualize the same data and extract exactly what we need. Here, veneers in the 3D printed model used by the dental lab to finalize the color. Trying in the mouth of the patient, the gum follow the finishing line. The try-in under the rubber dam, the isolation, we try in another time the veneers, so trying of the veneers under isolation, and then when we are sure I'm cementing the veneers under the rubber dam isolation. The post-operative view immediately after veneers cementation, and this is the result we achieved with the patient that is so happy for the final result. Gingival detail immediately after cementation. The seamless integration of soft tissues with the restorations bodes well for upcoming checkups. And so we start with this slide that is the building a personalized digital twin. We start from the biology to go through the predictions, so the diagnosis, the prognosis, and the therapy optimization. But the true excellence begins with the biology. It's through understanding nature that we can envision beauty before it takes shape. And so from predictions, we start another time from the biology. This photo says it all. Digital dentistry empowers us to blend clinical knowledge with technological accuracy, allowing a teamwork to drive each case to its best possible outcome. With no surprises, only precision. And I end with this last slide. Thanks for watching, and thank you Medit for organizing this webinar and for pushing the boundaries of what's possible in modern dentistry. Thanks from Italy, from Monza, from Dr. Andrea Bevilacqua.
Okay, thank you for sharing all your tips with us, Dr. Andrea.
Thank you, Jenny. Thank you.
So let's move on to Q&A sessions.
Okay.
So today we have 3 questions in total. So we'll start with the first one. Question number 1. What role does Medit scanner play in determining the ideal preparation techniques for veneers?
I think that with the pre-op scan and the thickness analysis tools, we can precisely measure the existing enamel of the teeth of the patient. And so we can compare it to the planned veneer thickness. So this prevents for over preparation, which could lead to the dentin exposure, and so problems about the compromised bonding and under preparation, for example, which could result in bulky over contour restoration. And so I think that this kind of workflow, it's perfect to do the ideal preparation.
Okay, thank you for answering about question number 1. Okay, next question. Question number 2. How can you selectively reduce enamel to ensure optimal addition of veneers?
The mantra is to scan and prep, So you have your intraoral scanner in your left hand, and in your right hand your burr to prep the teeth. So you can select reduce the animal doing this kind of action. So you have to open your program that is Medit eye scan, and while you are prepping the teeth of the patient, you have also to rescan the teeth as shown in the webinar.
So it's really important to reduce as little as possible to reduce the enamel part, right?
Yes,
so,
of course.
If you tell us about the scale, how many millimeters?
It depends on the material of the restoration.
Yeah.
So if you use the lithium disilicate, you have to prep more. And if you use the feldspathic one, you can also prepare 0.3, 0.4. So according with your dental technician, you can prep what you need.
So which material do you use the most?
I use both, with lithium and lithium disilicate with the Emax. Is the most common material, but also feldspathic one when I have to prep with, for example, for a young girl, also for a young boy. Yeah. But if I want to minimize the prepping technique, I have to prep 0.3, 0.4, and then scan, and then going through the feldspathic one. Yes.
Okay. Last question. Question number 3. How can the digital patient workflow and Medit technology improve the aesthetic predictability of the case?
I think that is the most important question that I have to answer, because the digital patient and Medit workflow is for me is central, because you start with the face of the patient, with the feet of the patient, but also you can also scan before prepping the teeth of the patient the mock-up. So you have the mock-up, you have the teeth of the patient, but while you are prepping with the digital patient that is inside of your software. So you have the Medit link, but also the Medit scan, that is the software that led us to scan also the face. So you are doing what you have planned. And so this is the key to achieve a good result and the goal that you, dentist, and also the dental technician have. You can follow up your patient with your face and with the veneers, and not only for veneers, but all the aesthetic case of the patient. We are talking now in this webinar about veneers, but we can talk about also all-on-X or all-on-4, or for example crown lengthening. But with this kind of workflow, you can achieve your goal.
Okay, so when you digitize patient, you do it for big cases, right? Not in small cases, you don't necessarily do it, right?
No, every single cases. So also
really?
Yes, because you have the pool of your patient that is a digital twin. So you have the digital patient of every kind of patient, because not only for the treatment, but also for the diagnosis, and also for the role of the AI. We are in 2025, but I don't know, in 2030, in 2040, in 2050, we can talk about another kind of dentistry, and the central role is the AI. And if you have data of your patient, you can be a super dentist, not only a dentist. Yes.
All the patients will really love your treatment because they can see your face, right?
Yes, I have an area in my clinic that is the fourth floor. Is a huge area with the angle for the photographs. So I can add photographs in the Medit link. So the first visit is the name of surname of the patient, and then DP, that is the digital patient. So I save it in the Medit link as this, and I have every single patient like this. So I can pause and follow. Yeah.
Okay, the last question was so fantastic.
Thank
Okay,
you.
so I think that's all about it for today.
Okay, thank you, Jenny.
Thank you for preparing such a great lecture and questions as well.
Okay, thank you.
Thank you for being here, doctor. See you next time.
See you next time, Jenny.
Bye-bye.
Bye-bye.